My name is Abdullahi Mohammud Ali. I'm 24 years old and I'm from Kenya. For the last 2 years, I was experiencing anemia. I went to many hospitals, many doctors, but to no avail. They didn't have answers to my questions. For the last 2 years, I couldn't concentrate on my studies and my work. My condition exacerbated to the point that I was being transfused blood after every 3 weeks. That's when I opted to come to India to seek for more professional help. A friend of mine recommended me to Apollo hospitals, telling me that Apollo hospitals is the best multispecialty hospital in Hyderabad and India as a whole. I was here for a period of 3 months, and with the 3 months I was here, I would say that Dr. Padmaja treated me with the utmost kindness, compassion. She was professionalism. What I liked about her was how she was professional, how she was kind, compassionate. And when I say compassionate, I mean it. I really mean it because, I remember one time I brought her the report because I did some tests. And when she saw my reports, she was very happy and smiling. And she was even happy than me myself, the patient. I will say thank you to Dr. Padmaja Lokireddy and all her staffs, from the secretary to her assistants. And I want to thank Apollo Hospitals as a fraternity, as a whole.
Hi, I'm Dr. Padmaja Lokireddy. I'm very pleased to talk about Mohammed, 24-year-old, who came from Kenya with a history of recurrent anemia. He has had a low hemoglobins for more than 2 years and has been needing lots of blood transfusions. Didn't know what was the diagnosis. He came to India for finding out, and he came to Apollo. He met me back in March time with hemoglobin of 4. And for the first time, he had a bone marrow, and we looked at the slides. We discussed that he has got a pure red cell aplasia. He may respond to simple treatments, but if it doesn't work, then we have to go for a treatment called ATG or a bone marrow transplant. It sounded a bit harsh, but luckily he has responded. I insisted that he should wait for at least 3 weeks for us to know that he's responding. Within the first 2.5 to 3 weeks, he started responding, that his hemoglobin started lifting up from the baseline of 5 to 7, and he stopped having any more blood transfusions. Now his hemoglobin is at 14, not needing any blood transfusions. He's just on one single tablet called cyclosporin. So some patients do respond for simple treatments. So we have to have the vigilance and the patience to see when to go for the next line of therapy before we embark on a major therapies. So I'm very pleased that Mohammed can go back today to Kenya and come back in a year just to reassess his disease. Thank you.